Dr. Lewis, to our podcast at Autism Spa. It's a real honor to have you here. I read about your work. I've seen what you're doing with Sancta Familia Center in Utah, right?
Well, actually, that's where I trained, but this is actually in Columbus, Ohio.
Columbus, Ohio now, that's right. So tell us a little bit about your background. How did you get into this field? And really a little bit more about the integrative functional medicine that you're involved in.
Sure, yeah. Well, I think like you, we were talking a little bit before this, that I got into doing integrative functional medicine because of a crisis in the family. You know, I was traditionally trained pediatrician and had been practicing for 9 years when my son was born and ultimately developed autism. Mm-hmm. And that he's now 22, actually, this month. Oh. And that changed my career, you know, because we wanted to help him, and we found that there was little known about what to do, except for behavioral therapy. And I'm not saying that that was wrong, but that, you know, as we've gone along, we've learned that a child with autism is a child that's, you know, medically ill. You know, they have a biologically impaired brain, if you think of it that way. So what we're trying to do is, what can we do to help unimpair their brain, help with their physical health so they feel well enough to engage with family or education or therapy so that they can actually recover their development? Because they're, you know, autism is defined by the developmental loss or the developmental arrest. So if we can help get some of that speech, social interaction, and other things occurring, then we can see development. And that's what we see.
Right. So I think your story is the same as I think many family stories, experts that get involved in the field. And some of them are not experts. They're just parents that want to do something as an alternative to ABA. But it's the fact that you're a doctor and you're a practicing physician helps you kind of apply your personal passion for this in this direction.
Right. And I would say that, you know, there's plenty of experts out there. I've met a lot of moms and dads that are experts. They're especially experts about their kids. You know, right. When I, as a physician, my goal is to get to know children, but I never know an individual child as well as their parent. You know, right. The other thing you said too is, you know, to do it instead of ABA. And that's the one thing I wouldn't say necessarily. I see what we do is really trying to help the individual, you know, that's ill, in this case, kids with autism or older adults with autism too, you know, access their ABA or their education strategy or their OT and PT and speech. You know, we're trying to make those things more effective. And when I was first doing some of the functional medicine things that I do now, I wasn't sure they were going to work because, you know, in medicine, we hadn't really talked about that. In fact, I didn't see autism in med school or residency.
Wow.
So what we've learned practically in trying to help people that have come to say, I need help, which is the same thing we did with my son is we need help. What do we do?
Right.
But some of the things that I do are really proven by the therapists. I tell the family, hey, we're going to do this, but don't tell the OT or, you know, don't tell the speech therapist, you know. And then I'd get a call from the OT or speech therapist and say, what are you doing? And I'd, you know, like, nothing, you know, of course. Lying. But I was trying to keep him blinded to a point, but it got to the point that when we did certain things, it was so obvious that they knew we did something. And that's what those were the provings along the way that helped me kind of change my thinking about what's really going on here. You know, is this a uniform illness with one thing, or is there many things we need to deal with? And the answer is there's many things we need to do.
Right. Yeah. No, thank you for that explanation. And I think you're right. Everyone I talk to, they look at the other therapies, whether it's music or something else, as a supplement to ABA to help ABA be more effective and help their kids even more. Right. So what are you doing at the center? I mean, what type of approaches do you have? What kind of conditions do you treat?
So, you know, I really started Sancta Familia to help kids with autism and expanded to more, you know, anybody with chronic illness. Autism population has a high incidence of PANDAS. And so that actually is something that I was trying to understand back in 2010 when one of my patients that I had seen for many years developed it and actually helped me really begin to understand it. Now that's almost 70% of what we do is PANDAS.
Wow.
And turns out that of the PANDAS that becomes difficult to treat, those persons commonly have a tick-borne illness and or mycotoxin illness. And those are things that we've learned. So now, we've done this so long, a lot of the patients have 2 or 3 of those things all at once. And that becomes very challenging to deal with.
So what is the commonality between these illnesses and autism? Because I think most people in this conversation may understand autism a little bit, but not the commonality between all of these other illnesses and the approaches to dealing with those.
Well, I guess I would say that, Lyme disease, we understand is an infection, but really there's acute and chronic kind of a picture to this. So you get a tick bite, you get a rash, you have acute tick, you have acute Lyme, you get treated with antibiotics, it's okay. Typically, you get treated long enough, proper antibiotic, make sure it's gone. It's something that you've taken care of. But in the case where it's not been recognized, because only 40% get a rash, the EM rash with a bite, so it becomes more chronic. So what happens in that case is, and this is one of the understanding that really helped me, is it becomes chronic immune suppressive and then starts to damage tissues. So stresses out the nervous system, stresses out the immune system, stresses out the gut. And so health starts to decline. As the individual declines in health, then they're less able to function and be well. And then, mold illness is really a toxic illness. So it's an insidious toxin that unfortunately can look like PANDAS, Lyme, and even cause neurologic abnormalities that can look like schizophrenia or other developmental problems. Wow. So I guess the common idea is, what's the root cause here? What is the root cause of this person's illness? In the case of Lyme, it could look like multiple sclerosis, but it's actually infection. So that it's the complexity of all is the similar difficult discussion of what's causing it, and we still don't have that complete answer what's causing autism, but we definitely know that there's pieces. The kid that's extra STEMI often has problems with, fungal dysbiosis in their bowel.
Right.
I found that many of the kids that had bite marks on their hands, that from biting and pain, they were constipated.
Yeah.
So when you cleaned them out, they didn't have pain and they didn't have the need to bite their hand. We've seen improved language when we use methyl B12. Wow. And so it's recognizing that there's these individual pieces that are making up making up the problematic development.
Right.
And any of us can agree with that. If you've ever been constipated, you're not thinking about anything else except going.
Right.
And if you're having diarrhea, you're not thinking about anything but where's the closest toilet. So, when you think about how physical illness can affect our behavior, then you can really understand how it affects development.
Well, I sometimes explain to people about autism. I go, imagine, let's say you have a GI problem, but you can't speak. You have a frustration or some pain, but you can't tell somebody about it or you can't express it. How frustrated would you be at any age? And so if you see behavioral implications of that physical ailment, and then you see the behavioral manifestation of those, that's what's going on with someone that's nonverbal on the autism spectrum.
Yeah, I mean, it's, and then let's say people get hangry, right?
Sure.
So a kid with autism that can't verbally express it, may not be able to say that I'm hungry, and they'll be getting hangry with aggressive behavior. Right. So it's starting to know the story of the individual so that we can understand, what's really going on with them. That one of the interesting things happens, in a child that's delayed and we start to heal the bowel, and all of a sudden you'd think, okay, they're doing better. They got better eye contact. And all of a sudden they're starting to get a little bit snippy, and you're realizing that they're restoring their development and they left off at terrible twos. So now all of a sudden as a 5-year-old, they're having terrible twos. Yeah. Well, that's actually an okay sign because they're going to move through that. Right. So that's part of, in any treatment of a person that's very ill, is getting to know them and getting to stay with them. You're walking with them through the healing process.
Right.
And then as a parent, you're in the weeds. You don't know that that's actually positive until you can have somebody step back and say, well, I think that's actually normal, and we'll see in a few weeks. Does it pass?
Yeah. Yeah. And, it's funny you say that, because I often also tell my wife and others, I go, look, maybe it's just being a kid. It's not autism. It's not something. It's just a kid being a kid. So they're still in there, even if they can't express it the way we understand expression. So if they're frustrated, they're frustrated. If you didn't have Wi-Fi, you'd be frustrated.
But it's especially good to see their humor come out,
right?
Because then that they're really processing. Because when they rib you, or they do something funny, or they fake things, then you're starting to say, okay, well, the processing's coming back. It's really good to see, that kind of thing. I remember one of my patients, he's 14 now, and I do goofy things in the exam to keep him laughing. And so one of them is I do the karate chop test. So I'll fake karate chop their stomach, and I really don't hit them, of course. And I said, so have you had the karate chop test? And the dad goes, oh yeah. And he takes his fingers and he puts them on his stomach, and he goes, you wouldn't hit a stomach with glasses, would you? And I know, it's, as a parent, you can just crack up at that, because, that took a lot for him to make that joke up on the fly.
Sense of humor is a sign of intelligence.
Right, exactly. Well, and that's him.
Yeah, but it's funny that they're in there. They just may not always express it the way, again, we understand communication.
Right.
They're they're communicating in their own way. And I think a lot of the conversations I had with experts, it's always about parallel play or learning their language instead of making the kid learn our language.
Right. So we have to reach the kid before we teach him. A OT friend of mine said that once, and that's so true. And that's true of anything in any conversation, not just a kid with autism. It's if we really want to have a relationship with anybody, then we have to reach that person. Right.
You could say that. You're right. You could say that about any human being on this planet. And then when you add to it the communication delayed problems that most kids have, this makes it more frustrating for them to.
Right. And then, as as a parent, one of the biggest challenges is people that don't have children with autism don't understand how difficult it is.
Right. It's difficult. It's very good that you say that. And sometimes when I explain a typical Tuesday to somebody, I see a little wrinkled foreheads and a lot of pain and frustration. I see their concern. Obviously, as special needs parents, we've become more resilient, and we're able to recover from pain and trauma a lot faster than ordinary parents, because we go through it all day. We're EMTs, right? 24/7. We're always on. Most parents are. So we're able to come back. But when somebody else sees my son having a meltdown, it's tough for them to see it. It's tough for them, and they think but we're able to process it. He's able to process it, get over it in 5 minutes, and we got on with our day.
And you're thankful that you have those people that understand that that's him.
Right.
And the bigger challenge is, when you're out in public and people are unaware, it's usually the parent who gets the brunt of being a poor parent.
Right. Which is because they see your kid. And my son has been waved a finger at in public once or twice when he was acting up, and somebody said, you should behave yourself or something. Some parent that felt entitled to say that to my son in public when he was acting up. But of course, again, as special needs parents, we have a certain radar. We see other parents struggling. We give them the space, the respect, the dignity that human being, the child deserves.
Right.
They're the same as your kid or anybody else. But sometimes I think when people are non-communicative, other people look at them as not really quite 100% human.
Right.
So it sounds like in your practice,
in there.
Go ahead.
There's a genius in there.
There is. There really is. And they're a lot more attentive than, let's say, most of us are. Every time I have a pimple on my face, my son comes and puts a finger right on it. My wife may not notice, but my son notices right away. They don't miss a thing. They have immense, that clarity, I think, that sometimes a lack of emotions brings. When you're not clouded by your emotions as much, you're able to focus. Even if you can't communicate, you're still able to focus. And it's just, frankly, I'm not a doctor, but I sometimes feel this is the next stage of human evolution, where people are becoming so smart and attentive. Until they learn to communicate, they will be looked on as disabled or developmentally delayed. But it sounds like your practice is geared, I think, wonderfully based around the individual, understanding the individual first. And to be honest, I just don't see that in pediatrics anywhere. We go to them and they got a rash or they got a bump, they get a medicine and off they go. There's really no effort, no understanding, because as you said, you didn't learn about autism necessarily per se in med school. So most doctors wouldn't know how to treat a child with autism unless there's a physical disability, something that shows up on a CAT scan. There's no treatment in any ordinary pediatrics.
Well, as you said, when you were talking about, you started doing blogs, and your blog on autism started to run into your other blogs. One of those is, the delivery of healthcare is, set up for itinerant things, and not for long-term health and optimal health. That's the functional medicine approach. It takes time. Right.
And it takes patience. And I think most people aren't educated enough to give their child all of those options. And that's why I wanted to have this conversation with you and others to make sure parents are aware of all these other options that are out there, if they're able to either reach you or others that do this focus. Let me ask you about stress, because it's something we're all experts in, especially in these family. And you recently wrote an article on stress and healing. Tell me about that and how that works into your work.
Well, in my training in medicine, a lot of it was exactly as you said. We're talking about physiology, or we're talking about biochemistry or something. Stress is something that affects those things, but sometimes we don't think of it, but if you can distill it down many ways, but think of it as it's pro-inflammatory, and inflammation out of control is bad because stress is out of control, right? And it's also pro-oxidative. So oxidative stress is what we talk about as one of the other long-term cumulative damages to the body. So stress in that circumstance is negatively affecting physical, mental, and spiritual health.
Right.
Which then, if you think at other levels is, well, the brain, the bowel, the nervous system beyond the brain, and then that ultimately affects sleep. And anybody that's had a kid that doesn't sleep at night knows the next day is kind of troublesome. And if you're not sleeping every night for a long time, then you know what's happening. Your body breaking down. So that's stress in a nutshell.
Right.
Breaking down the natural body's defenses. And so the goal then is what can we do to actually restore health and stress-free living? Not that it's ever going to be completely free of stress, but it's stress-tolerant living, I guess.
Stress management.
Right, exactly.
Right. So exactly right. I mean, parents struggle with stress, and we can identify what stress and anxiety and depression look like. We can't always identify that in our kids. And when they're not communicative, even more challenging. So stress is a part of, or managing stress is a part of healing the total body that we're talking about.
Yeah. And as we've treated more and more patients with these combination of things, ASD and PANS, or PANS and Lyme and mold, and all four, is kind of getting an idea that, the stress tank, in the body's full. So we talk about the autonomic nervous system, or the unconscious nervous system, it's very tense, right? That we can't tolerate anymore. And there's theories now that are talking about stress at the cellular level, shutting down the cell, called the cell danger response. So we have to think of the whole picture here and recognizing that stress and illness may go all the way down to the cell. So and stress does that. So those things that we're doing to try to mitigate stress, to calm down our autonomic nervous system, things that we're trying to get a safe signal down to the cellular level, are key things for longevity and immediate wellness, both.
Wow. Well, talking about calming stress, tell me about your work with the listening program, because we've had conversations on this podcast about the listening program. It sounds amazing. How did you get involved with that?
Well, I met Alex Doman, who's the CEO of Advanced Brain, on a not-for-profit board. And he said that, he said, well, let's chat sometime about the listening program. Have you heard about it? And I'm like, yeah, I have, but I just haven't really used it. And he told me about it. And he goes, I think you'll find it as a useful adjunct for your patients on the spectrum, and he didn't even talk about others. Right.
Yeah.
And that was an understatement.
Yeah.
I think even for him, once we started talking about the things that we've seen, and because it really now has become a game changer therapy, and we use it for PANDAS and Lyme too.
Wow.
My theory is, when we talked about calming down the stress of the nervous system, I think it does that. In addition to all of the science behind auditory frequencies and what they do, which is beyond me, not him, beyond me. But I can say, just from a practical standpoint, it was like, holy cow, we saw kids take off that had just plateaued.
Yeah. Any case studies? I mean, as you applied it either, to your patients or to even your own family, have you seen it work?
Oh yeah, absolutely. That's what I mean. It's, I use it. Recently, I was finishing up the Achieve program, one of the ones for greater creativity. And there's different colored zones in the music, kind of indicating what it's working on. And I was in red, which is working on the frontal cortex. And I'd been in it for 2 straight weeks, and it was too much for me within the stress that I was having in my job. So I was a little snippy.
Yeah.
So maybe a lot snippy. You have to ask my wife. But, I said, I recognized it finally. And so I'm like, okay, well, I'm going to go back into calming colors, and I did. And I felt better within a day and a half.
Right.
So I can tell you it does affect change. I've seen that personally. I've seen it in my wife, it's helped with stress too. Yeah. But in patients, I mean, one of the ongoing success stories is the guy is now 26. We first saw him when he was 22, and he has autism, had seizures, aggression, very sensory. And doing some of the biochemical things and GI stuff, functional things, we could help calm him, but we couldn't completely get rid of that sound sensitivity. And so we wanted to help him with language. So we didn't know what we were going to get here, because that was one of the big things we see with TLP2. But not only did we see him calm down and become less sound sensitive, he actually potty trained.
Wow.
You can imagine how big that is for the family.
That is big. Let's spend some time on that, because you're saying that music, the listening program, and really the programs that outfit puts together, calming music, a couple of times, a few minutes a day, over a few weeks, few months, led to dramatic behavioral changes and improvements on a ASD adult.
Yeah, well, it did. I can't guarantee that's going to happen with everybody.
Right.
But go back to what we were talking about. Remember, it's the multifactorial approach.
Right.
We were healing his bowel, and that continues to be a problem. We were healing his sensitivities. We were healing, all the things that were, his seizures were in pretty good control with medicine.
Right.
Adding in the listening program gave a whole new avenue for him to relate to the world, because it probably helped his auditory processing. It clearly helped his sound sensitivity. Okay. Right. He couldn't hear a siren without punching out at somebody out of irritation.
Right.
Okay. So, he all of a sudden was now able to relate to the world receptively and expressively in a brand new way.
Wow.
And interesting. And one of those was the awareness that, oh, I have to pee.
Yeah.
And I can hold it and go in the toilet rather than have to, and to some degree, that's any of us. If we don't know what we're really being faced with, we don't know how to process it.
Right.
As I tell people, the core deficit in autism is social language. And the easiest way to tell it is women know what I'm talking about because all guys have a little bit of it. Right. Folks on the spectrum have a lot of it. Right. And if that language is a foreign language and you don't speak it, you're not going to know it. And my first degree is in German. So if I started speaking German, unless you knew it, you wouldn't understand it. Right. And I did intensive German. So I actually sat at the lunch table 4 days a week when they only spoke German. And, it was gobbledygook the first day, but even within weeks, I was starting to get a gist of some of the language. Yeah. Same thing. If we can help the child with autism, adult with autism, begin to understand what's really going on and that actually somebody's addressing it to them and would like a response. If they have a physiologic feeling in their body and they can respond to it, now we're just getting into basic communication.
Right. So this is fascinating. This is really why I'm doing this podcast. I want to provide parents with, again, alternative supplements to what they typically get in the square box that most kids are stuck in educationally from a healthcare system, social system. So let me just follow up and ask, how can families either get to you or to this type of a service in the current box they're in if they're not in Columbus, Ohio?
Well, I actually wish I could answer that well.
Yeah, that's okay.
Because I was medical director at the Pfeiffer Treatment Center, and that's no longer. I decided I wanted to do more long-term therapy, on the ground with more than just biochemistry treatment. But when we did biochemistry at the Pfeiffer Treatment Center, that was a big piece of what helped.
Right.
So looking for somebody that understands what we did at the Pfeiffer Treatment Center and understands how to heal the bowel and how to look at these things functionally is what we're really looking for. So there's different integrative functional practices. The key is to find one, I think, that really has experience in kids on the spectrum. Right. It would be great to have a center where we had OT, speech, behavioral therapists, psychologists, and medical personnel that were looking to combine whatever the person needed, right? To get them the best experience. Not that I'm aware of exists, but
right. And that's something I think, again, why I see some parents starting their own therapy centers, right? I mean, a pet, whether you have a lab or, it's a dog training, horse pet therapy, music, whatever. Everyone's trying something different to supplement the conversation. And then obviously a lot of these therapies are not covered by insurance. Right. So most families have a tough time getting access to them, which is a big deal in this country. Right. So that's just something I think we just have to, as a larger community, figure out how to, especially the disadvantaged communities, minority communities that may not have access to those facilities, how do they get help? Because typically, as I often talk about on this program, kids don't come with a manual. Right. Special needs kids come with either nothing or even an overwhelming amount of what's institutionally available that may not be helpful. Mm-hmm. And that's really the cracks in the system that special needs families have to find to navigate to help get the best care they can for their kids.
Right. I've been spending so much time learning new things. It's always striving for a better understanding. I haven't done as good a job as I'd like to actually consolidate it, and get it down into a process. And it's something that's been on my mind for a couple of years. I have to think about legacy planning, even at the clinic, Right. And so I have 2 nurse practitioners with me, one who's new, now 9 months, but he's really doing a great job of picking up. And the one that's been with me for 6 years now, Nicole, is super sharp also. But, she's part-time and the stay-at-home mom. And so, and that's not stay-at-home, but she does part-time. And so she doesn't have the time to kind of get it on paper. So I have to, we need to get it down into a method.
Right.
And the method has to be variable because there's no top to bottom treatment.
Right. Well, I'm happy to help you with that process as a consumer or as a friend, because I can tell you, as a special needs parent, you're just overwhelmed with a lot of bureaucracy, a lot of things that don't work, and chances are ABA will work for some kids, and otherwise some other kids may not have as extreme or as severe a disability or a delay, and maybe they just have some social interaction problems, but a lot of families are dealing with severe disabilities, severe delays, self-injury. Some people have it tough, and they have it tough times 4 or 5 kids on the spectrum.
Right. That's what I mean. You think about one child, you may have more than one. Yeah. And then that stress leads stress on the family. Yeah. So the parents and the marital relationship, in some sense, that's something that I think about, what can we do to help preserve the marital relationship? Because, that causes a lot of stress.
It does. And actually, that's why I called my programs Autism Spa, because I wanted to encourage families to take a spa day and hopefully get some sponsors in the spa community that want to help special needs families, because ultimately you need to create a cocoon of comfort and safety and consistency that is peaceful and has hopefully managed stress. Right. So your child can flourish. Right. None of these things will work if you have an intense, stressful home environment. Unfortunately, and then you expect your child to somehow be catapulted away from that and somehow miraculously benefit. It's not going to happen if the home environment is very stressed out.
Yeah, one challenge, at least in the medical part of this, is when you do integrative functional medicine, it doesn't have double-blinded placebo-controlled trial for everything that we do. Rather, we do more what's called single subject study design. We have this one person and we do something, see if it's helpful or not. The problem is medicine is so accustomed to this double-blinded placebo-controlled trial that it's hard to get what we do within that framework, because you have to take a different perspective. And so unfortunately, that may mean some family members are purely, in traditional medicine, and some are purely opposite. And the idea is we really need a commingling of these disciplines to say, what's really working for the person, because that's really my success is based on what helps the child or helps the family or both.
Right. Right.
And one of the questions I ask when they come in is, if you could take a magic vitamin, what would you want it to do?
Right.
And I ask it because I'm curious what they really find difficult, but that is actually the measure of success in their mind.
Right. We got to make these, as you say, I think, supplements more accessible to the community at large across this. We have 50 states holding hands as a country. Each one has a different set of health insurance, facilities and requirements and coverage and God knows what. And it's just really tough for some families. There are some states that still don't even offer as full benefits to ASD, right? Which is just astounding to me. But those that do, if you go to your pediatrician and you eventually get a diagnosis from your local regional center of diagnosis of autism at 3 years old, it would be nice if that system can refer you to multiple options, such as your center. Instead of just a pediatrician, they'll give them a couple of aspirins and say, come back tomorrow. The total child needs a lot more care a lot earlier on in their life than in their teens.
And I would, in defense of the docs, they see with insurance reimbursement, the way what's happened, they, the reimbursement went down almost 50% from 2003 to 2010 when I was in private practice. So that means my partners who I left had to see twice as many patients for parity in revenue.
Wow.
And that's not possible to do this kind of medicine at that volume. It's not even possible to do this kind of medicine at the old volume.
Right.
Somehow we have to find a way to do this either in a group setting. It seems to me an insurmountable barrier. I know it isn't, but it just seems tough. And the other is, if you haven't lived it,
right,
don't know what it is. And if you haven't seen kids get better, then you don't know it's possible. We see that. That's, kids that have lost the diagnosis,
Right.
3 years ago was one of my patients that I'd seen for 15 years, and he was going off to college, and they said, well, this, I think, is going to be our last visit. And I'm like, well, I'd love to put myself out of business like that because that means he went on to college.
You're right. Pediatricians, doc physicians generally always care about their patients with a great passion, but they still have to work within a system and a framework that's made available to them. So it's not their fault. It's the system that we must reform over time to allow for more alternatives, especially if after a certain number of years, you see it hasn't worked, or it hasn't worked to the measurable results that, let's say, parents and educational systems think is the right milestone for that child. Right?
Yeah.
So,
well, one of the success stories is one of my patients who had autism and PANDAS, and we did many things. He had seen another provider too to try to help his PANDAS, and we just couldn't keep him from having flares. And eventually we put him on TLP, and his flares stopped. So it wasn't the biologic piece of what was going on in his PANDAS that was causing him to flare. It was his sensory stuff. So that helped. Well, ultimately, we've had many other gains with him too, because then we were able to do other treatments, hyperbarics and detox and other things, such that I just found out he is gone from the one low functioning tract to the academic tract in his school. And none of his teachers have ever seen anybody do that shift. So that's we helped heal his brain, and now, he's not done improving yet.
Right.
Only starting middle school. I
tell you that's every parent, special needs parent's dream. They don't necessarily want their kid to go to Harvard or Yale. They just want their kid to be the best they can be.
Exactly. Yeah. And, it's so the unwritten rule, if when you see the patient the first time is if the kid ain't sleeping, the parents aren't sleeping.
That's right.
So we got to get sleep.
I can attest to that. One last question. Key takeaways. What do you want to leave parents with, families with, in this work, and what to expect maybe in the coming years?
Well, the parents are really the expert in their child, so they have to trust their instinct.
Right.
That's the first thing.
Right.
And I've learned that through the years in different situations, especially in patients that have difficult to manage problems, because the parents know their child and they know if it's helpful or not helpful. So just trust their instinct. The other is to be skeptical about anything, even what I just said. I tell folks, whatever I say has to result in improvement. I know everything that we're going to try is not going to work. So, just because it's worked for somebody else doesn't mean it's going to work for our child.
Right.
So we just have to be honest about that and decide, okay, and then take off a little bit at a time. There's just so much to think about, what really would make life better and healthier, and many parents are looking for a better interaction in the family. Well, sure, that'll be the first step, So I say don't give up hope. That's one of the biggest things.
Right. Right.
But don't sell yourself short either.
Right.
As a parent.
No, I think that's well said. Number one, don't give up hope. Try to keep a stress managed home life for your kid. Be skeptical, but trust your instincts.
Right.
Which I think if you have, as a parent, if you subscribe to those philosophies, opportunities and solutions and improvements in your child's life will come to fruition, whether it's through this, conversation or other services or whatever is available in your city or town or state, right. Other than just ABA, which is definitely the core subscribed benefit, treatment, but there are other options too.
Right. Yeah. So there's just so many things to do. One has to decide what sounds right for their family.
Right.
And not everything works for everybody. I wish my job would be much easier if I could just go on a checklist and say, do this and guess what?
Yeah. No, that's what I tell my wife too sometimes. Hey, we're doing the best we can.
Right.
And you shouldn't stress yourself out as a parent if you feel like, oh, I should have done this, I should have done that. I know a lot of parents are so stressed about just that point because they love their child. They want to see them get the best service, but physically, emotionally, spiritually, if you're doing your best, that will have to do because ultimately your child needs you, the
right.
parent, more than anything else, more than any other treatment.
Absolutely.
Your child needs you first.
Absolutely. I mean, if I knew what I do today, 20 years ago, my son would be better than he is today.
Well,
I truly did my best.
Yeah.
So did his mom.
That's right.
So he did his best. So yeah, it's the what ifs can really be a hang up.
Yeah. But, like I said, as a parent, I've let go of some of those things. I sometimes ask myself and others, are you doing the best you can? I'm doing the best I can with what I have for as long as I have it. Right. And that's as good as it can be because ultimately your child lives in your life, your home, your sphere of influence, not on an imaginary virtual world. It's, ultimately, a hug with your child, that's the best treatment. I'm not a doctor, but I play one on TV. I'm telling you, just loving your child, helping them be the best they can be is always going to be the best treatment, period.
I'm Catholic. Pope John Paul is a very brilliant man. And he said, a person is not someone to be fixed. They're someone to be loved.
Right.
And you said, as I didn't quote it probably very right, but it's the main idea is that, we're loving these people.
Right. I think well said. I think those are great final words. Dr. Lewis, thank you so much for being with us. I really appreciate your insights. I hope we can stay in touch as new developments and treatments come up. We would love to have you back.
Thank you very much.
Thank you.